welcome back to my channel. If you're new, my name is Anne. So we need to talk about the matter going round now. They are saying that the majority of people that are passing away from this coronavirus in the UK are actually black. They are saying that black people are 4 times more likely to pass away from coronavirus than the general population. And this is alarming, this is shocking. We have lost a lot of nurses, doctors, carers to this disease. And it's something that we cannot ignore. It's something we need to talk about. Just recently, a Nigerian nurse based in the UK, her name is Onyanchi Obasi, she lost her life to this virus. She lost her life to coronavirus, and I, share my condolence. I pass my condolence to the family, and I hope God gives them the fortitude to bear the loss. This woman, she is a 51-year-old woman that passed, unfortunately, to coronavirus. She worked at Queen's Hospital in Romford, and we start asking the question, what is going on in the UK? How can we be the minority? We are like 30% or less in the population in England and Wales. How can black people be the minority, and yet they have the most, they are the ethnicity with the most people losing their lives to this virus? It's like, we need to ask the question, because I know a lot of us are working as key essential workers. What can we do to be more safe? How can we keep ourselves safe? How do we make sure that we don't, like, people working in these key services are not bringing this virus to their children? The thing is this, right? I am comparing this situation with Africa, right? Because this situation is very unique to UK and America, which is that 70% of people that are casualties are black. Is very, very unique to me, and it's very, very scary to me, because let's compare to Africa, Nigerian specifically. The virus is actually slowing down in some parts of Nigeria where they are observing social distancing, because the issue in Kano is very different from the issue in Lagos. Lagos has gone through lockdown. They have gone through lockdown. People that have actually had this coronavirus, they are recovering very quickly. So the casualty in Africa, the casualty in Nigeria, I beg your pardon, is very low, and people are recovering faster. So why is the black person in Nigeria recovering and the black person in the UK, losing their lives to this coronavirus? And bear in mind, they keep saying that, the blacks in the UK, they are key essential workers, they're the nurses, the carers, the cleaners. But we still have nurses and doctors in Nigeria. The people treating coronavirus patients in Nigeria are actually fellow Nigerians, and there is high success or high recovery rate in Nigeria. It's very scary to me. It's very shocking to me, the statistics that the UK government is putting out there. And I'm asking the question: are they giving those people good training on disease and prevention control? It's not about training being available. Is the training good? Are they giving them quality PPE? That's for those that don't know, personal protective equipment. Is it of good quality? You understand? And they're saying that another reason they're saying is that the black or the African person in the UK, maybe we might be lacking vitamin D. That the black person, that they are not. They can't absorb vitamin D from the European sun that we need, like the African sun. Is it the African sun that is actually helping people in Nigeria? Because they are saying that we need the vitamin D to boost immunity. But then again, when they talk about the matter of key workers, I understand that the majority of the people working as carers and other key essential workers, they are black. But we also have some Caucasian people doing this job. We have Caucasian people doing this job. So, I mean, it cannot just be vitamin D. It cannot just be, there has to be other factors. Because it can't just be people are losing their lives because of vitamin D. These are nurses. These are doctors. These are carers. People are aware of their health. Are you saying they don't have vitamin D in their multivitamin supplement? I mean, it's just, it seems far-fetched to me. You understand? And another thing I want to say is that when this virus first came out, the caution was that it affects most elderly, and the elderly, they're the ones that are most affected by coronavirus, and they should be the ones much more protected. Now the other news is turning around that is lack of vitamin D. That is why black people may be prone to, you know, being victims or casualties of this coronavirus. The stories keep changing day in, day out. Are these experts, are they, like, they keep giving us new narrative, new statistics? I think the experts are actually learning. The more casualties, the more they are learning from this virus. Probably next week or a month from now, they're going to come out with another new information about this. I am not really sure about the vitamin D. I mean, I don't think it's because of lack of vitamin D people are, I don't believe that that's the reason why the black people are, you know, passing away from this virus. Maybe they need more training, maybe they need quality PPE, maybe there need to be more guidelines around, you know, handling victims of coronavirus, because the nurses in ICU are actually dying, and we need them, whether they are black or white, we actually need them to stay alive so that they can keep working. That is my own opinion about this thing. And this nurse that died, Onya Chiobasi, the very unfortunate thing about her is that she left behind, she survived by a 19-year-old son, and according to the news I read, they said he is said to be vulnerable and dependent on the mother. Now, the news did not explain what they mean by vulnerable and dependent on the mother. You know, I hope the Lord gives him the fortitude, the son, the fortitude to bear this loss. And it is so painful when I think about the black people that are losing their lives to coronavirus. It's so painful, you know, to see people that have come all the way from Africa for greener pastures, working hard for themselves, working out for their family, their children, supporting families back home, and they just lose their life on the line of duty. It is so painful. It is not just, they're not just losing one life, it's like a community losing it. People that are going to lose, that are going to be affected either directly or indirectly from the lives of this black migrant. It is enormous, and it's so painful to see all the sacrifices, and it's you know, the sacrifices, the hard work, pushing on, pushing forward, just end up like this. I mean, I don't know what to say. They didn't even say if this woman, if she was a single mother, because when I was reading the news, they only said she was survived by the son. They didn't say if she was survived by the husband. And the fact that they said the son is vulnerable and dependent is kind of heart-wrenching. I really hope she's survived by her husband, someone that can support the son as well. You know, it's just, it's terrible. And my heart really goes out to all the single mothers, because I just kept thinking about, imagine if you're a carer or a key worker and you're a single mother, and you have to be, not just are you scared for your life, you're scared bringing this virus to your home after your shift. I mean, if something happens to them, who is going to care for it? It's just, it's unfortunate when I keep thinking about this coronavirus, you know. And the unfortunate thing is that in the black community, there seems to be more single mothers, you know, losing their lives. They even say that, according to the report, that the black women actually are in higher risk than the black men to lose their lives to this coronavirus. And knowing our community, you know, what support is available for the single mothers at this time. And I also want to talk about another point that the government is not talking about. You know, they are not talking about illegal immigrants, right? The government is so focused about the UK citizens or people with legal status, and they've totally abandoned the most vulnerable in our society. These people work in, we can't ignore them. We can't ignore them during coronavirus because this virus does not discriminate. It doesn't discriminate whether you have papers, you don't have paper, you're British, you're not British. For us to defeat coronavirus, the government needs to be more inclusive. The people, the illegal immigrants, need to be able to access social welfare, and they need to be able to access healthcare. I mean, there is a new law that they can access healthcare, but I don't know how comprehensive it is. And it's so shocking because when you compare the way the UK government is handling this issue when it comes to illegal immigrants, it's so totally different from the way Portugal is handling this. Because I remember in March when this virus took hold in Europe, especially in Italy, the Portuguese government actually made a new law that an illegal immigrant, whatever you have, whatever your status is, they gave them temporary citizen rights, whereby they can access healthcare, they don't have to worry about payment, they can access social welfare, they are giving them accommodation. Because to beat this virus, everybody in the society needs to be able to be protected. You need to be able to give them funds. If you're telling people, oh, there is a lockdown, they need to stay at home, and they cannot feed themselves because they have no recourse to public funds, that is the illegal immigrant, they will go out to get a job. They will go out to get a job, and that increases the risk for everybody. That is just the point. I don't think this is the time to be playing politics with people's lives. Human rights is actually much more important in the whole scheme of things. You know, the virus don't know the difference between a British citizen and a non-British citizen. I think we need to address this issue. The government needs to address this issue and they also need to give more protection to single mothers that are actually key essential workers. They keep saying, I think they say if you're in the NHS and you pass away, there's a fund of like £60,000. What about people that are working with the NHS but they're not working directly for the NHS, they're working with agency? What about them? What about families like that? What are the plans the government is going to make for them? I think at this point, at this junction, it's only God that can save us, because I don't have the solution. I just feel it's something that we as the black community, we have to talk about it. We actually have to engage with the government, write a letter, call your, I don't know who's working with in your local, whether your local council, we need to work with them. And another information I want to pass out is that if you're an illegal immigrant and you're watching this video, try and reach out to charity organizations. I think the food bank is actually closed, right? They are closed down. You know, you can't access welfare, you can't access benefits, even though you've lost your job during coronavirus. The government is not acknowledging your existence. I think as an illegal immigrant, my information or my tip to you is that try and just reach charity organizations. Don't be afraid. Reach out to them. There are some charities that are actually fighting for your right. There are some charities that are actually fighting for the government to include you in, you know, this coronavirus program. Just reach out. Don't die in silence. Don't cry in silence. Don't. Reach out to as much charity organizations you can reach out to. If you have family and friends, reach out to them, because at this point it's only God that can save us. I have spent too much time talking on this video. If you've enjoyed videos like this, consider subscribing, smash that subscribe button, and like I always say, feel free to share this video on WhatsApp, share it on Facebook, and until next time, bye guys.